Days before AAPCHO, it was interesting trying to survive as a community health clinic serving Asian Pacific Islanders. There was a very little recognition on the federal level that Asian Pacific Islander communities had health needs that were not being addressed, and therefore the federal government did not create funding that was available to health centers.
It was really the first time that there was a national presence for Asian health issues. Although there had been, like, the clinics, Northeast Medical Services, Asian Health Services, and some of the other clinics had been around for a while. It was the coming together of people into these different groups that really launched the Asian health movement and started to bring attention to those issues on a national level.
We just wanted to meet because when we met, there was this amazing collegiality that we're facing the same kinds of challenges locally, and that many of us wanted to make sure that we could muster whatever support we could because our task was quite overwhelming.
One of the reasons for getting together was to provide in a group a large enough population so that if we wanted to do community-based, community-driven research, we'd have enough sites and enough places for that to happen.
We recognized that compiling our data was essential to addressing any of the problems that existed within our communities because they went essentially unrecognized.
Right in the early 80s, in late 70s, there's a myth that Asian really had no problem. You can take care of yourself. You're a model minority.
We were able to look at the data of each of our health centers and sort of collaborate and compile those and make a stronger case of what kinds of health issues were particular to Asians: hepatitis B, thalassemia, TB, and have the health programs on a national level reflect more of those needs in their research and data collection.
But not being a health professional, I wasn't aware of all of the intricacies of what was lacking in the field. And so in those days, AAPCHO, Asian Health Services, Asian Pacific American Health Forum, and a number of others were really instrumental in educating me about things that were needed.
And I think AAPCHO played a key role in being the leader for all these community health centers, and also to come to the bargain table with HRSA, with any federal agency that's going to pay attention to us. You have a central voice.
What everybody really needs is regular, consistent, culturally competent health care.
80% or more of our patients actually are monolingual, non-English speaking. Many of our patients tell us that in this setting, this was the first time that they actually were able to make their needs known and also feel comfortable about communicating with the provider, either directly or through our interpreter services.
When they'll ask Native Hawaiian patients about physicians and medical care and stuff like that, and a lot of them will respond that they feel more comfortable with a Native Hawaiian doctor. So I felt it was important for me to come back into the community. And Waimanalo is a largely Native Hawaiian community. We have about 50% of our patients are Native Hawaiian.
It is very important in this community that people feel that they have a medical home, that they're listened to, that the environment and the values that are expressed here are their own.
So I think that community health center had that kind of vision. It's really a good one, and that is, provide really comprehensive healthcare service to anyone, regardless whether your ability to pay, and try to provide multilingual, multicultural, enabling service so that the patient really can have a direct language with the provider.
to really transform the commitment that our government has and our communities have towards the health of all people. It's going to take advocacy.
Policymakers need to be educated on issues. We have the heart, we have the sense that we want to do work with the communities, but AAPCHO's partnership with us, like in Hep B, it brings people together.
I think the core of democracy is being able to have a voice to speak the needs of the people. And so advocacy becomes very important because it challenges people to become responsible for their health care.
And so that's why it's so important to have community organizations that are on the ground, who see those problems on a day-to-day basis, who can then give their advice to policy makers and the professionals at the state and federal and local bureaucracies.
The work that AAPCHO has done from the community level and bringing all the information together and digesting in a way that makes policy makers understand what it is that needs to be done is invaluable.
Also, it was important to work with AAPCHO because AAPCHO was the first organization representing Asian Pacific Islanders that allowed them voice. There are many organizations that serve Asian Pacific Islanders, but we're not at the table discussing our needs.
We made some major headway in language access. There's still lots of people that aren't getting linguistically accessible services. We've made headway in having more health centers in places in communities that weren't getting served. There's still numerous communities that aren't getting served.
I think in the future, AAPCHO can be a leader in research. I think that we can compile information and data on the patients that we serve, and we can prove the value of the services that we're offering people.
I'm an immigrant. I have to learn the American way, the hard way. I wasn't always a squeaky wheel, but I found out that if you don't be a squeaky wheel in the public health service, you don't get equality. You're going to have to speak up, and that's why we need AAPCHO.